Hi, my name is Nimisha. I'm employee health nurse and injury coordinator at Menorah Medical Center.
And I'm Jenny Vial with HoverTech International.
We are going to talk about the regards med transfer today.
Our first task is going to be turning our patient with the regard mat. We'll start by taking our air supply hose and inserting it into either the left or right side port on that regard mat. You'll open up your Velcro flap and then insert this in at an angle, lining up the snap and then wrapping the Velcro around it. So you're going to insert it in at an angle, snap it, and wrap it. Okay. Now we're going to turn on our air supply by hitting the purple button. We're going to wait for it to fully inflate. Okay. So we're going to turn our patient towards me. So we're going to push the hover mat in the opposite direction, and we're going to place a pillow in between the patient and the rail. Okay. So what we're going to do is I'm going to press down on the shoulder and the hip of the direction that we want our patient to turn. Okay, that second caregiver is going to hand me these handles. Okay, and we're going to turn the standby off. So now that it's deflated, we could see the outline of the patient's body, so we can place in our positioning wedges and pillows. Okay, and that completes our turn. Our next task is to boost with the regard mat. So while the regard mat is inflated, if you have a 300-pound patient on this device, you're then actually boosting, pushing, and pulling only 30 pounds at that point, because this shrinks their body weight down to 10%. Okay, so we have our air supply hose inserted to the Velcro flap. We have it snapped in, and then we're going to wrap it. So now we'll go ahead and inflate it, and we're going to wait for it to fully inflate before we start our task. Okay, so this is where we're going to take the shoulder and the hip handle, and then rather than twisting and hurting our back, we're going to take a step into the boosting direction. So on the count of three, one, two, three, we're going to take a step and boost our patient. Count of three, one, two, three, steps and boost our patient. Okay? Then we'll hit the standby button, and the mat can remain underneath the patient for your next task.
Okay. So whenever we are boosting patient with ergonomically perfect position, we can prevent the neck, back, and shoulder injury and strain, and it significantly reduces the patient weight. So you are helping your patient and yourself.
So now we're going to be doing a lateral transfer with just 2 caregivers. Once again, any patient that's on this device, so if you have a 300-pound patient, then you're actually only pushing and pulling 30 pounds at that point. So we have our second caregiver in place. We have our patient lined up on the regard mat. So we're going to go to our air supply after inserting our air supply hose in, and we're going to hit the purple button to inflate. Okay, so we're going to wait for the hover mat to fully inflate. Once that's done, I'm going to push the head end of the device out first to my receiving caregiver. She is then going to capture the shoulder and the hip handle and stabilize the device while I go to the end of the bed. And then we're going to do a visual inspection to make sure that the patient is centered on the bed. And then we're going to turn off our air supply.